Hello, my name is Dr. Saib Gallagher. I'm a plastic and reconstructive surgeon with a special interest in gender affirmation surgery. In this video, I'm going to talk about two procedures that a lot of trans feminine patients aren't aware of. And I always say whenever we're educating ourselves or preparing for any sort of gender affirmation surgery, you really have to know all the options available, because in this field, really the patient needs to be fully informed so they can decide what's going to be most affirming for them. So there's two procedures that I often hear from trans feminine folks that they had no idea that this was available and an option, and it was just by chance they happened to come across it. So the first one is orchiectomy and scrotoplasty. And so what this means is when we remove the testicles, we can also tidy up the scrotal skin down there at the same time. There's a few different reasons folks may want to do this. They prefer that smooth appearance, it makes things easier to tuck, and they want rid of the extra skin. And for many patients, this may be all they ever want or need for their surgical transition. Typically, I recommend not doing this procedure if you think vaginoplasty is in your future. In general, we want to keep all the spare parts available just in case we need them at the time of vaginoplasty. So that's number one, is scrotoplasty. It's a quick and easy outpatient procedure and very gentle overall. We leave a scar usually about this long, dissolvable stitches down there, usually about a week of downtime. So that's procedure number one. Procedure number two, I used to hear many years ago, a lot of folks say that they had no idea that this was even an option, and that is a zero-depth procedure. It's also known as a vulvoplasty. There's a few different names for it, but basically what it means is we're feminizing everything on the outside, but we're not creating the canal. There's a number of reasons folks may choose to do this. So first of all, most of the scarier complications that happen with vaginoplasty are due to making that vaginal canal. It's overall a very safe surgery, but in folks who want to avoid those complications, this may be a really good option for them. It also, of course, depends on their sexual habits. If they don't want or need a vagina as part of their sexual practices, there's not a lot of point in doing it. And also, it can be very useful as a procedure in folks that have a reason that we can't do vaginoplasty or create that canal. The most common reason for this is when we've had surgery down there before. One of the more common ones is a radical prostatectomy. It can make creating a vagina very difficult and tricky and a high-risk procedure. So usually we don't do that. Zero-depth procedure or vulvoplasty is really useful in those groups of patients who don't want or need the canal, and the recovery is faster, the hospital time is shorter, and it's just good to be really informed on these different options so that you can make a decision on what gender affirmation surgery is right for you. We have pictures of these procedures over on our website.